Induction of labor. What if you don't go in natural labor? Is there an option, or you just have to go for cesarean section? Well, there is an option, and that is induction of labor, which you doctors choose to do to help you have a normal baby. That's what we're going to discuss in this video. Hi, I'm Dr. Mukesh Gupta, obstetrician and gynecologist from Lenest, Mumbai. When a woman doesn't go in labor and we have to artificially induce pain, we call it induction of labor. It is done in a specific situation and circumstances which are favorable for both mother and baby. For example, the dates have crossed and the woman is not delivered. For example, if the baby is not growing well and is required to be brought out for some reason. Or if there's some complication like raised blood pressure which is not getting under control and calls for action by the doctor. Well, there can be many more such reasons, but one thing that you need to remember is the idea is to help Mother Nature to deliver the baby when the natural labor is not started. What are the contraindications for this induction of labor? Well, if there is a very low-lying placenta or a vasa previa, or if there is a pathology, for example, a fibroid in the lower segment, or if there is bad infection in the lower genital tract which can cause trouble to the baby while delivering, or if there is no space for the baby is too large and cannot just come down, if there is a cephalopelvic disproportion. All these factors are contraindications for labor, and there are many more factors your doctor may tell you why. What exactly is done during the induction of labor? Well, when you are planning for an induction of labor, your doctor or your midwife or your person who's taking care for your labor is going to explain you in detail about why the induction is necessary, what will be the process and the protocol, and how you can choose the optimal method for you. For example, in our kind of setup, what we normally do is if a woman is requiring induction of labor, we try to first assess her cervix and realize that what is her Bishop score, and accordingly we decide. What is the Bishop score? We look at the cervical length, the consistency, the position, the station of the head, and of course last but not the least is if there is already an existing effacement or dilatation which is there or not. So all these factors will help us to know whether this lady is having a favorable chance for delivering or not. So there are two components we have to understand. One is cervical effacement and second is cervical dilatation. Now, for ripening of the cervix, if it is a very unfavorable cervix, we would like to start with something like a prostaglandin gel or a pessary, which helps us. Sometimes even a prostaglandin tablets are being used, which helps us to improve the cervical score or ripen the cervix. If it leads to labor, very good. If it doesn't, the other option that is available is Oxytocin Drips. Now these oxytocin are started with a very low dose and then they are accelerated. Mind you, whenever this is being done, the baby is constantly under close monitoring to rule out if there's any risk for the baby landing up with any complications. So an induction of labor is actually a process by virtue of which a woman who would otherwise have landed up with a C-section because of no pains is helped to have a normal delivery, and it's a great option to try. Thank you very much.